Today, we are taking a deep dive into an economic and demographic reality that, well, it feels like it should be headline news every single day, but somehow it just operates in the quiet background of our lives.
Mm,
We're talking about population growth in the UK specifically, the engine of that growth.
the natural engine, yeah.
Historically, natural population growth, more births than deaths, was the most reliable, almost boring given of national life.
It just happened.
It just happened. It was this unyielding foundation. But based on the sources we've gathered for you today, we have to start with an absolutely shocking fact.
It really is.
Natural population growth in the UK is essentially static.
Gone.
When we look at the raw statistics, births are hovering right around 600,000 a year, and deaths are also around 600,000. Sometimes deaths are even slightly higher.
So it's not just slowing down.
No, it has flatlined. It's a zero-sum game demographically.
And when you put that into its historical context, the gravity of that change, it just becomes so clear. I mean, for centuries, growth was a demographic guarantee.
Right.
If you go back to 1801, the UK population was around 16 million. Skip forward a century, 1901, and that figure had surged to 38 million.
And today?
Today, we're just under 68 million.
Wow.
And what's truly fascinating here is how strong that natural engine was, even throughout the 19th century, when Britain was, exporting people by the million.
Americas, Canada, Australia.
All over the world, the population still powered ahead. Natural growth just overpowered all of that immigration. So for that fundamental engine to have essentially stalled in our lifetime is change of proportions we just haven't seen in the modern era.
That sets our mission perfectly, then. This isn't just a cultural observation.
No, it's systemic.
It's a systemic shift.
Mm.
We need to look past the vague vibes or simple blame and use the sources to unearth the quiet policy decisions, the economic levers that cause this self-generating engine of growth to just, well, stop running.
Yeah, let's unpack it.
Unpack this quiet crisis and see what the data tells us.
If we look closely at the data referenced in the material, we can actually pinpoint when this started to turn. And it wasn't a sudden crash. It began quietly.
When was that?
Around the early 1960s. That's when the total fertility rate, or TFR, started its long, slow decline.
Right.
In those early 1960s, the TFR was, healthy women in the UK were having about 2.5 children on average. That's comfortably above what you need.
And what do you need?
To maintain a population naturally, you need a replacement rate of about 2.1 children.
And today?
Today, the average is closer to 1.4. That is a dramatic structural undershoot.
And what does that 1.4 rate really mean for you, the listener, in the long term? It means this compounding effect that is incredibly difficult to reverse. We are not just treading water.
We're shrinking.
We are shrinking. At current rates, each generation is roughly 30% smaller than the one that preceded it.
And while it's true that people are living longer, which is a fantastic success story, adding about 10 years to the average lifespan, the raw math of births versus deaths shows that the natural population engine has entirely stopped. We are effectively heading toward a much smaller society if this trend isn't reversed.
Okay, now when this subject comes up, the immediate reaction from a lot of people is to pivot to migration.
Oh.
It's the loudest part of the whole demographic conversation. So we have to tackle this head on. Is migration the primary cause of all this?
This raises a really important question about sequence and necessity. When we analyze the findings in these reports, the clear consensus is that migration didn't create the demographic gap.
It filled it.
It has, over the last few decades, been used to fill the gap.
Okay.
Think about the systemic need. Once births stopped comfortably outpacing deaths, the pressure was immense to maintain the basic functionality of the economy, of the tax base.
You need workers.
You need a constant stream of working-age people to pay taxes, fund services for an aging population, and staff critical sectors like healthcare, social care.
So rather than being the source of the demographic shock, migration became the systemic solution, the outsourced mechanism to keep things in equilibrium.
Precisely. Migration stepped in to prevent a swift economic contraction and a collapse in the ratio of workers to retirees.
And that explains something.
This is why the sources argue that migration becomes such a loud and urgent political flashpoint precisely at the moment that natural growth stalls.
It's not the cause, it's the response.
It's not the cause of the decline in fertility. It is the unavoidable pressure valve that keeps the lights on, despite the collapse of that fertility rate.
Okay, here's where it gets really interesting and, frankly, a bit uncomfortable. If we accept that the problem is rooted domestically in our own policy choices, we have to look at the specific quiet economic shifts that have essentially priced out the next generation.
Mm.
The sources identify four key drivers. Let's start with the first one: longevity and the timing of wealth.
People living longer is, unequivocally a great societal triumph, but it has profound and often unintended economic knock-on effects. The most significant structural impact is on generational wealth transfer,
Specifically, the timing.
specifically the timing of inheritance.
So, how does extending life expectancy by a decade or more fundamentally alter that timeline?
It's all about access and utility. When people live longer, they hold on to their primary asset, their housing wealth, for much, much longer.
Which means,
It means inheritance arrives much, much later in the next generation's life. And crucially, it often arrives after the most important, economically demanding family formation decisions have already been made.
can you walk us through that generational contrast? The sources mention it specifically. What was the timeline like for, say, those born in the 1940s versus those trying to start families today?
It's a huge difference.
Yeah.
For those post-war generations, inheritance often arrived when they were in their late 40s or early 50s.
So they're still working, still earning well.
Exactly. Still in their prime earning years, and their own children were maybe teenagers or just starting their own independent lives. That influx of capital, maybe £100,000 or £200,000, could be immediately deployed to support the establishment of the next family unit.
We're talking house deposits, university costs.
House deposits, underwriting the early expensive years of childcare. It was productive, generative wealth. Contrast that with today. Due to longevity, the average age of receiving an inheritance has shifted forward by an entire decade,
So late 50s, early 60s.
commonly hitting the late 50s or even early 60s. By that point, the receiving generation has likely already dealt with their own high housing costs, and critically, they've already made their key decisions about family size.
The window has closed.
The window for that capital to materially support having a child has closed. The decision about a third child, or even a second, is often made in your late 20s or early 30s.
Based on what you can afford then.
Based on affordability and space, then. Money arriving 30 years later is simply too late to influence fertility. Instead, that money is used by the recipients themselves to top up their own inadequate pensions or pay for late-life medical and social care.
So the wealth is still transferring, but it's missing that critical moment.
It's missing the moment it could facilitate population growth.
Okay, so later inheritance is one piece of the puzzle. But the sources point to a more fundamental shift that happened at the same time. The very purpose of housing changed.
Yes.
That leads us to the second major policy driver. Housing was effectively repurposed as a personal safety net.
To understand this, we have to look at the collapse of the traditional pension system, the old defined benefit or final salary schemes. They were only sustainable based on certain assumptions.
That people would retire at 65 and then die 10 years later.
Pretty much. Retire relatively young and only live for another 10 or 15 years, supported by a vast working population. When medical advancements meant people routinely started living into their late 80s and 90s, and that worker-to-retiree ratio worsened, those guarantees became financially unmanageable.
Especially for private companies.
Oh, absolutely. And that's what drove the big move to defined contribution, or DC, schemes.
Which are just personal savings pots.
Correct. And the risk shifted quietly but completely from the institutions onto the individual worker. This meant retirement suddenly became something you had to self-insure for maybe 20 or 30 years.
And for most people, the only asset big enough to do that is their house.
It's the only asset big enough. It transforms from a place to live into a personal financial vault.
And the sources emphasize that means-tested social care policies just lock this in even further, right?
Absolutely. The need for long-term care, residential care, end-of-life support. It forces people to draw down their property wealth because the state support is means-tested.
So housing stops being something you pass on.
It ceases to be bricks and mortar for the kids and becomes the necessary safety net to cover these potentially massive late-life expenses.
But that wealth just leaves the family.
A significant portion of that wealth leaves the family balance sheet altogether. It exits the generational transfer loop.
Which brings us directly to the third driver, and perhaps the most immediate one for many young listeners: the staggering affordability gap. The way housing costs just sprinted away from wages.
Yeah.
We need to hear the specific numbers here from the 1970s onwards. How bad is that comparison?
The comparison is, well, it's almost unbelievable. Since the 1970s, UK house prices have risen by 8 to 10 times in cash terms.
And even after inflation.
Even if you rigorously adjust for inflation, that's still a 3 to 4-fold increase in real value. Now look at real wages over the same period. They grew only 1.5 to 2 times.
Wait, just so I have this straight. The asset required for family stability increased maybe 4 times faster than the real income needed to buy it?
That is the synthesis of the data. Housing now costs, relative to a person's earnings, approximately twice as much as it did a generation or two ago.
And that creates massive insecurity.
Immense insecurity. And we know insecurity is the enemy of family size. When you cross-reference this affordability data with fertility rates, the correlation is stark and undeniable.
So birth rates are lowest where houses are most expensive.
Consistently lowest where housing is most expensive, most insecure, and hardest to plan around.
It fundamentally destabilizes your planning horizon. I mean, children require stability, they require space, predictability.
Oh, yes.
The sources nail it when they talk about needing parents who can think in decades, not 12-month tenancy cycles.
That's it, exactly. If you're constantly worried about renewing a lease or escalating rents or scraping together an impossible deposit, having an extra child becomes not just challenging, but economically irrational. The decision becomes less about desire and more about cold economic risk.
Okay, now for the fourth and final policy driver, which acts as a multiplier on all the others. The active policy squeeze on family support.
Mm-hmm.
While all this was happening, governments were making specific choices to balance the national budget, largely because of the rising cost of supporting that aging population.
Pensions, healthcare, social care.
So what were these quiet mechanisms they used?
The sources detail how support for younger families was tightened in several ways that didn't require big headline-grabbing announcements.
Ouse.
We saw eligibility criteria narrowed, support thresholds were frozen for long periods, and the values of benefits were just allowed to erode in real terms.
So the cost of raising children just crept up silently year after year.
Exactly. Without a single policy being labeled, we are making it harder to have children. Childcare costs are a prime example. They became more expensive, the system more fragmented, acting as this massive financial barrier.
And the two-child cap is the definitive example of this quiet squeeze, isn't it? It puts a hard number on it.
It is the critical policy example. Measures like the two-child cap essentially turned the marginal cost of having that third child from merely challenging into definitively unmanageable for hundreds of thousands of households.
It's an explicit cap on the state's support for family size.
It is.
The combined effect is just devastatingly clear. These policy choices, all framed as fiscal responsibility, steadily raised the cost and risk of having children right at the same moment people were dealing with insecure housing and inheritance arriving a decade too late.
It's the perfect storm.
So let's bring this full circle for you and connect all four drivers into one systemic conclusion, the whole chain of events.
Let's do it.
People live longer, which is a wonderful thing.
Good news.
But that means wealth is held longer and arrives too late. Simultaneously, pensions were weakened, forcing people to use housing as self-insurance. This combined pressure drove housing costs drastically away from wages. This environment makes starting a family feel fundamentally riskier. Birth rates fall, natural population growth stalls.
And migration steps in to fill the gap. What's fascinating here is how deliberate, even if unintended, the outcome is. This entire sequence of events is not a mystery. The ultimate finding is that this is a system doing exactly what successive politicians have set it up to do.
Through layered, incremental choices.
Yes, choices that prioritize the economic security of the existing electorate. The sources conclude that the UK didn't suddenly lose control of population growth. It consciously or unconsciously priced it out of the next generation.
Which means the solution isn't where most people are looking.
If we truly want that natural population growth to recover, if we want to see the birth rate climb back toward that 2.1 replacement rate, we cannot achieve it by focusing solely on controlling borders or tweaking migration numbers.
The focus has to shift fundamentally back to economic security for young families.
Exactly.
For natural population growth to recover, people who already live here need to feel economically stable enough to commit to larger families. That means tackling those core drivers we've discussed.
Affordable, stable housing, predictable long-term costs.
and policies that actively support rather than quietly penalize people for having children. The knowledge we've gained today moves the issue out of this realm of abstract cultural worry and into concrete, solvable policy and economics.
It does. And before we wrap up, here's the provocative thought for you to carry forward, based directly on the economic flows we've explored.
Okay.
We established that the wealth needed for the next generation's stability, the housing equity, the early cash injection, is currently tied up in the previous generation's self-insurance against longevity and care costs.
The transfer is stuck.
It's stuck. It's arriving too late and being depleted. So ask yourself this. What specific ethical policy mechanism could be introduced to retime that flow of generational wealth, to ensure that it arrives when young families desperately need it most to facilitate growth and stability, but without sacrificing the necessary security and dignity required by the elderly in their retirement?
That is the puzzle.
That is the economic and ethical puzzle at the heart of restarting the engine of natural population growth.
Something substantial to mull over until our next deep dive. Thanks for joining us.